The news day continues here on One News Now. I'm Riza Diaz. The health department logs over 6,900 cases today, less than 1,000 lower than yesterday. Today's figures account to 3% of the active cases, which are now over 81,000. The total caseload still stands at 2.7 million. At least 95 new deaths were recorded, also lower than yesterday's 156. The death toll is now over 40,000. The recovery count, meanwhile, is now approaching 2.6 million mark with over 10,000 new survivors. The positivity rate slightly dropped to 12.5% from yesterday's 13%. COVID-19 infections are on a downward trend in the country, but OCTA Research data shows other areas can still be considered hotspots. In an interview with One News, Professor Guido David of OCTA Research said Zamboanga del Sur, Zamboanga City, and Zamboanga del Norte are showing the highest risks. Other areas seeing a surge in COVID-19 infections are Western Visayas, Northern Luzon, the Cordilleras, and Isabela Province.
Although the trend is decreasing nationally, and that's because the trend is decreasing in the NCR and Calabarzon and Central Luzon, there are still some hotspots, areas where they're just seeing a surge in COVID cases.
Some 1,151 minors were vaccinated against COVID-19 last Friday, prompting officials to declare the first day of the pilot run of the pediatric vaccination a success. As planned, the initial rollout of vaccines for minors was administered on those in ages 15 to 17 bracket who have comorbidities. The health department said no adverse effects have been so far recorded. Currently, there are 8 hospitals in Metro Manila that are conducting the pediatric vaccination. The Trade Union Congress of the Philippines flags the no vaccine, no salary scheme implemented by several employers. In an interview with One News, TUCP spokesperson Alan Tanhusay said they have received reports that some employers were not giving the salaries of their employees unless they submit the vaccination card. Tanhusay added that the complaints were already reported to the Labor Department.
We asked a Labor Secretary to conduct labor inspection of the work site. And we are also asking Mr. Bello to issue a guidelines that would serve as a warning to all abusive employers against this illegal practice.
Tanhusay said employees experiencing this can report to their respective DOLE regional offices. They can also seek help from the TUCP as some employees do not want to be identified due to the fear of reprisals or terminations.
There are a lot of consequences, legal and financial consequences for the employers who practice this kind of illegal actions towards their employees. Number one, it is a violation of the human right, obviously. Number two, this is a violation, direct violation of labor code provision that says the employer should not withhold the salary of their employees without the consent of the workers. Number three, they are liable for double indemnification.
COVID-19 vaccines have led to a drop in deaths during the Delta variant surge, but some countries saw deaths fall to a greater degree than others. Let's find out more in this video.
So the question that we really wanted to answer with this project was, the same types of vaccines in places, the Western developed economies, which are highly vaccinated, are we seeing a different impact in these places, or is the effect of the vaccines really the same? And so what we did was to take the places that had vaccination coverage of over 55% and bigger places with populations over 1 million. And then we further narrowed this to a group of places that had seen a wave of cases pre and post vaccination. In some places, vaccinations seem to be able to bring deaths down to a much bigger level. And the question really was why, and what can the world learn from that? So, of course, there are many factors that affect fatalities. The analysis is really only looking at the impact of vaccination. There's so many other things that do come into play, of course. But some of the big takeaways that we could see in that contrast between places that really managed to get deaths really down after vaccination was the length of the interval between the first and second vaccine dose did seem to play an important role. So for the European countries that managed to bring fatalities down to just 10% of what they were at the previous peak, we saw in places like Denmark and the UK and Germany, for example, they were administering vaccine doses 6 weeks apart. In the UK, that was up to 8 to 12 weeks apart. Whereas in places that have brought deaths down to a smaller level, the US, Japan, Israel, they were administering vaccine doses only 3 to 4 weeks apart. We've seen that those longer intervals actually do boost the immunity level much higher. We've seen this now from studies. The second dose is more powerful when the first dose has been given that time to fully mature in the body. And that could play an important role. And there's a lot of lessons there for countries that are now still ongoing their vaccination campaign. And so what happened to those earliest vaccinating countries? By the time Delta came through and started spreading across the world, those initial doses, we do see the immunity has already waned, and that could have played a part in the fact that vaccination did not provide as strong of a shield towards Delta compared to other countries. So, the global vaccination campaign is still ongoing. There are so many countries, especially in the developing world, that don't have any meaningful vaccination protection at all. And with the virus becoming endemic, we do know that vaccinations may become a regular thing. What this analysis can tell us, is to give scientists, policymakers, an inkling of some of the things that can be done to strengthen that shield of immunity against new variants. Because as we know, there is a great fear that Delta is not the only new mutation that's going to come. The world could be swept by another new variant. And with the vaccination strategy, things like longer dosage intervals, waning immunity, that could influence how countries now continue with their vaccination progress and how they can get that shield of immunity even stronger.
Ilocos Sur is starting to recover from Typhoon Maring with the assistance of its provincial government and other private companies providing aid. Laila Pangilinan with the story.
The province of Ilocos Sur is slowly recovering from Typhoon Maring, days after its onslaught. In Santa Maria, the market is still covered in mud and only a few stalls have opened. This makes it hard for residents to go buy their necessities. The Bureau of Fire Protection and a few volunteers are working together to clean the market. Mud also covered the carcasses of drowned pigs which were found at the back of the market. Stall owners fear that they may not be able to pay rent as most of their supplies have been wiped out.
Pero yung mga ibang mga paninda namin, mga radyo, cellphone, accessories, wala na, sira na lahat. Importante, walang namatay. Pero yung paninda namin talagang wala, back to zero na.
However, Santa Maria Mayor Brigido Camarillo Jr. assures retailers that the rent will be waived.
Hindi ko muna sila pag-uupain. Talagang may isang buwan siguro na wala silang upa.
Private companies have also offered assistance in the province, like TV5's Alagang Kapatid Foundation.
Maraming salamat din sa Alagang Kapatid Foundation. Nagbibigay na ng food packs, may charging station pa.
Manakta na tulungan kami. Kung nakaawat kami ti ayuda. Ura na parigat ka na palagan basit ti biyag mita adda.
The provincial government of Ilocos Sur also allocated 500 sacks of rice for affected residents. Former Senator Bongbong Marcos also sent relief packs, while Ilocos Sur Governor Ryan Singson vows to extend its assistance to all LGUs affected by Maring. To better assist residents, the funds to purchase COVID-19 vaccines will be reallocated for relief and rehabilitation efforts for the province.
Nagbibigay naman po ng nasyonal ng mga bakuna, kaya okay na po sa amin yan basta magamit namin yung pondo para sa mga nasalanta ng bagyo.
The provincial government has temporarily lifted the negative RT-PCR test results for those who wish to conduct humanitarian missions in the province. A negative antigen test result, however, is still required from the volunteers. The S-Pass accreditation is also waived, but only humanitarian mission from the government and big corporations are exempted from the negative RT-PCR test result. Volunteers are also required to coordinate with the provincial government as well. For News 5, Laila Pangilinan, we are One News.
Let's now take a quick look at today's other top stories. Typhoon Maring leaves 1.87 billion peso damage to agriculture, affecting over 60,000 farmers and fishermen. Production loss amounted to over 91,000 metric tons. The Agriculture Department vows to provide a 1.5 billion worth of assistance to the affected sector. The Senate Blue Ribbon Committee is set to release an initial report on its probe into the multi-billion peso deal between Pharmally and the Budget Department. The report is expected to delve on the participation of each individual involved in the alleged procurement of overpriced face masks and shields. And crowds of people are flocking to the newly reopened Dolomite Beach in Manila Bay as Metro Manila downgrades to Alert Level 3. The artificial white sand beach is now open from 8 a.m. to 11 a.m. and 3 p.m. to 5 p.m. daily. Now, for more updates, visit News 5, The Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on a Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.